Imagine you have been taking medication for years, hoping it would improve your health and quality of life. Now, you realize that this medication might be harming your cognitive health. This harsh and concerning reality is something many people face. Today, we are tackling a topic that affects millions but is rarely discussed: medications that may lead to dementia and those that can help prevent it. Dementia, or cognitive decline, encompasses a range of progressive neurological disorders that lead to a reduction in cognitive function and memory, significantly impacting an individual's quality of life. Currently, various medications are available to manage and treat dementia, which can be categorized into two main groups: those that help alleviate symptoms of dementia and those that might trigger or worsen the condition. Please make sure to watch the video until the end to stay informed and maintain your health. In this video, we will examine 6 medications, 3 that are used to reduce symptoms of dementia and 3 that may contribute to or exacerbate dementia. This examination aims to provide a better understanding of the available treatment options and the potential effects of these medications. 1. Diphenhydramine. Widely known by the brand name Benadryl, is a commonly used medication to alleviate allergy symptoms, cold symptoms, and even as a sleep aid. While its efficacy in these areas is well documented, there's a darker side to this seemingly harmless over-the-counter drug that you might not be aware of. Recent studies have raised alarms about the long-term use of diphenhydramine and its potential link to an increased risk of developing dementia and other cognitive impairments. Diphenhydramine is an anticholinergic drug, meaning it blocks the action of acetylcholine, a neurotransmitter involved in learning and memory. When taken frequently or over extended periods, diphenhydramine can contribute to a significant decline in cognitive function. Imagine slowly losing your ability to remember simple things like your loved one's names or how to perform everyday tasks. This terrifying reality is what some individuals may face after prolonged use of diphenhydramine. The implications are particularly alarming for older adults who might rely on this medication to manage their allergy symptoms or insomnia. The seemingly innocent decision to take a pill for better sleep or allergy relief could potentially pave the way to a life overshadowed by cognitive decline. Healthcare professionals are increasingly advising against the regular use of diphenhydramine, especially in the elderly. Alternative medications with a lower risk profile are recommended. Before reaching for that bottle of Benadryl, consider the potential long-term consequences. It's crucial to consult with your doctor about safer options for managing your symptoms. The risk of cognitive decline is not worth the temporary relief. Prioritize your brain health and be mindful of the medications you choose. 2. Anticholinergics. Anticholinergics are a class of drugs commonly used to treat a variety of conditions, including allergies, respiratory disorders, gastrointestinal issues, and certain psychiatric disorders. These drugs function by blocking the action of acetylcholine, a critical neurotransmitter in the brain and central nervous system. Recent research has highlighted a concerning link between long-term use of anticholinergic drugs and an increased risk of Alzheimer's disease and other forms of dementia. Acetylcholine plays a pivotal role in cognitive processes and memory function, and its inhibition can negatively impact brain performance. Studies have indicated that individuals who regularly use these drugs are at a higher risk of developing dementia compared to those who do not. The risk is particularly pronounced in older adults, as their brains are more sensitive to reduced acetylcholine levels. Furthermore, some anticholinergic drugs can cross the blood-brain barrier, directly affecting the brain and disrupting cognitive function. This is a significant concern, as even low-dose, long-term use of these medications can potentially contribute to cognitive decline. To mitigate these risks, healthcare providers recommend minimizing the use of anticholinergic drugs, especially in elderly patients. Exploring alternative treatments with less impact on the central nervous system is crucial. For instance, Non-anticholinergic options should be considered where possible. Comprehensive patient evaluations and careful risk-benefit analysis by healthcare professionals can help in making informed decisions to prevent the exacerbation of dementia symptoms. This approach is especially critical for individuals at high risk of developing Alzheimer's or other dementias. By reducing reliance on anticholinergic medications and opting for safer alternatives, the risk of cognitive decline can be significantly minimized, promoting better long-term brain health. 3. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are a class of medications widely used to treat conditions related to excessive stomach acid production, such as gastroesophageal reflux disease, GERD, peptic ulcers, and Zollinger-Ellison syndrome. These drugs, including omeprazole, esomeprazole, and lansoprazole, work by irreversibly inhibiting the proton pumps in the gastric parietal cells, thereby reducing acid secretion in the stomach. While PPIs are highly effective in managing acid-related disorders, their long-term use has been associated with several potential risks and side effects. One notable concern is their impact on cognitive function and the potential risk of developing dementia. Emerging research suggests that long-term use of PPIs may be linked to an increased risk of cognitive decline and neurodegenerative conditions. The exact mechanism behind this association remains unclear, but it is hypothesized that the alteration in stomach acid levels could affect nutrient absorption and lead to deficiencies that impact brain health. Moreover, prolonged PPI use can affect the absorption of essential nutrients, including vitamin B12, calcium, and magnesium. Deficiencies in these nutrients have been linked to neurological issues and cognitive decline. Additionally, chronic PPI use may alter the gut microbiome, potentially contributing to systemic inflammation and affecting brain function. To mitigate these risks, it is crucial to use PPIs only as prescribed and to review their necessity with a healthcare provider regularly. For those requiring long-term therapy, periodic reassessment and consideration of alternative treatments or strategies to minimize PPI use can help reduce potential adverse effects on cognitive health. Addressing these concerns proactively can support overall well-being and cognitive function. If you've enjoyed watching this video so far, please give it a thumbs up and subscribe to our channel for more content. Next, we'll discuss medications used to manage and potentially reduce the symptoms of dementia. 1. Donepezil, Aricept. Donepezil, commonly known by its brand name Aricept, is a widely prescribed medication for the management of Alzheimer's disease. It falls under the category of cholinesterase inhibitors, and its primary mechanism involves increasing levels of acetylcholine, a neurotransmitter crucial for cognitive functions such as memory and learning. By inhibiting the enzyme acetylcholinesterase, donepezil enhances the availability of acetylcholine in the brain, which can help mitigate some symptoms of Alzheimer's disease. The therapeutic benefits of donepezil are well documented in improving cognitive function and slowing the progression of symptoms in Alzheimer's patients. It is known to provide symptomatic relief and can enhance daily functioning, thus improving the quality of life for individuals with mild to moderate Alzheimer's disease. Clinical studies have demonstrated that donepezil can lead to modest improvements in memory, attention, and overall cognitive function, allowing patients to maintain their independence for a longer period. However, despite these benefits, it's crucial to be aware of the potential risks associated with donepezil. The drug's effect on acetylcholine levels, while beneficial in managing Alzheimer's symptoms, can also result in side effects, including gastrointestinal issues, muscle cramps, and bradycardia. Moreover, as the disease progresses, donepezil's efficacy may diminish, and it is not a cure for Alzheimer's disease, but rather a tool to manage its symptoms. Given these considerations, patients and caregivers should be vigilant about the balance between the benefits and potential side effects of donepezil. Regular monitoring by healthcare professionals is essential to optimize treatment outcomes and address any adverse effects promptly. While donepezil can offer significant improvements in managing Alzheimer's symptoms, it is vital to understand both its therapeutic potential and its limitations to make informed decisions about its use. 2. Memantine, Namenda. Memantine, marketed under the brand name Namenda, is an NMDA, N-methyl-D-aspartate, receptor antagonist used primarily to treat moderate to severe Alzheimer's disease. Unlike cholinesterase inhibitors like donepezil, memantine works through a different mechanism by regulating glutamate, a neurotransmitter involved in learning and memory processes. Memantine modulates the activity of NMDA receptors in the brain, which helps to reduce excessive glutamate activity. Glutamate is crucial for synaptic plasticity and cognitive function, but in excess, it can lead to neurotoxicity and contribute to the progression of neurodegenerative diseases. By regulating glutamate activity, memantine aims to improve cognitive function and reduce symptoms associated with Alzheimer's disease, such as memory loss and confusion. Clinical studies have shown that memantine can lead to modest improvements in cognitive function and daily living activities. It may also help stabilize symptoms and slow the progression of Alzheimer's disease, particularly in more advanced stages. Memantine is generally well tolerated, but side effects can include dizziness, headache, constipation, and confusion. Despite its benefits, memantine does not cure Alzheimer's disease and should be considered as part of a comprehensive treatment plan. Regular monitoring by healthcare professionals is essential to evaluate its effectiveness and manage any potential side effects. 3. Rivastigmine, Exelon. Rivastigmine, known by its brand name Exelon, is a cholinesterase inhibitor used to treat mild to moderate Alzheimer's disease and Parkinson's disease dementia. It works by increasing levels of acetylcholine, a neurotransmitter vital for cognitive functions such as memory and learning. Rivastigmine inhibits the enzyme acetylcholinesterase, which breaks down acetylcholine, thereby enhancing its availability in the brain. Clinical studies have demonstrated that rivastigmine can improve cognitive function and daily living activities in individuals with Alzheimer's and Parkinson's disease dementia. It may help stabilize symptoms and provide modest improvements in memory and behavior. Rivastigmine is available in oral and transdermal patch forms, offering flexibility in administration. However, potential side effects include nausea, vomiting, diarrhea, and dizziness. Long-term use requires careful monitoring, as gastrointestinal issues and other adverse effects can impact quality of life. Rivastigmine is not a cure, but can be an effective part of a comprehensive treatment strategy for managing dementia symptoms. By reviewing these 6 medications, we hope we've provided you with a clearer understanding of treatment options for dementia and their potential impacts on cognitive health. Remember, consulting with a medical professional and carefully evaluating your medications can greatly assist you in managing your cognitive health. If you found this video helpful and informative, please give it a thumbs up and share it with your friends and family. Your comments and experiences are also very valuable to us, so be sure to leave a comment below. Thank you for staying with us until the end of this video. Take care of your health, and until the next video, goodbye.